What I tell my pregnant patients about exercise is I want to see them before they get pregnant so that I can make sure they're on a good exercise program that's comfortable for them. If we don't get to see them until they become pregnant, we make sure that we take a full history to see what their baseline exercise tolerance is and what have they been doing before they became pregnant. And generally, we allow them to go ahead with that exercise program. And for our patients who are very, very physically active, we tell them to make sure to take breaks about every 20 to 30 minutes in terms of exercising to allow their tissues to reoxygenate. We make sure that patients who are not that physically active become physically active through walking, very light weightlifting, although truth be to tell, an emerging pregnancy or growing pregnancy is like progressive weights. So we do tell patients to please maintain their physical activity as comfortably as possible. First of all, if a woman is intending on becoming pregnant, or she is of reproductive age and she's not using a contraceptive method, she is at risk of becoming pregnant. So first of all, if she does not want to become pregnant, she needs a good contraceptive method. If she does want to become pregnant, we advise patients to not drink. The reason for this is because of fetal alcohol syndrome, which is a spectrum of disorders which includes physical characteristics and includes central nervous system effects from mild learning disability all the way through to frank retardation. The point is there is no safe level of alcohol in pregnancy. There is no study that has been done that will say a tiny bit of alcohol, one drink or one glass of wine, for example, will not cause fetal alcohol syndrome, either the mild or the severe form or anything in between. The point is there is no safe level of alcohol in pregnancy. There are so many children who are being born with learning disabilities these days. We know that women of reproductive age and women who become pregnant are consuming some alcohol in certain cases. We can't tell them with any degree of certainty that what they're doing is safe. So what we tell patients, what I tell my patients is, there's no safe level of alcohol. However, this is not a time to panic. So if you find out you're pregnant, and let's say you know, by example, you know that on a certain night that you were consuming alcohol, that you were sexually active, and that may have been the time that you conceived. This is not a time to panic because, in fact, you will not have ovulated yet, and the pregnancy will not be established for about 10 days to 2 weeks. So that does not place you at risk. But not to panic, but just to know it's time to probably not be drinking. And after all, pregnancy does not last forever, it's 9 months. So afterwards, certainly, that would be the time to be able to have a little bit of alcohol afterwards, after the baby's born. During the time of organogenesis, when the baby's organs are being formed, this is probably the major danger period in terms of alcohol consumption. That would be the first 8 or so weeks of the pregnancy. After that, you have the anatomic changes that happen during organogenesis. And from 8 weeks on, you have functional changes which may occur to the baby's central nervous system, by way of example, from alcohol, which can be affected if you do drink. Again, it's not a time to panic, but it's a time to realistically look at what you would like to have as the outcome for your pregnancy. After all, most moms, most parents want their babies to be the healthiest and happiest as possible. We had a lot of ideas going back many years, including that the placenta filters out everything. In fact, we know through very good scientific research and randomized controlled trials and meta-analyses that this simply isn't true, that there are many molecules which cross the placenta. We're finding out that breastfeeding not only is best because it increases mother-baby bonding and it's just better for the relationship between parent and child, but we know now from studies that are just emerging this year that the long-chain omega-3 fatty acids in breast milk are so very, very important for the baby to have in terms of intellectual development. As a matter of fact, one paper recently published in The Lancet followed about 6,000 breastfed babies. It was a wonderfully done study. Found out that the average IQ point increase was 4 to 6 IQ point increase in those babies, and they followed them for a very long period of time. Those children grew up to have a higher educational level and, believe it or not, a higher earning capacity. So not that we're breastfeeding our children so that they'll earn more or go farther in school, but we want our kids to be as healthy as possible. We know that as much breast milk as possible is best. The American Academy of Pediatrics is very clear that at least 6 months of breastfeeding, the baby does not need any other food except for that breast milk for 6 months. As much as 12 months may even be better.